Welcome back, Psychonauts. So today we're going to take a look at a scientific study which was conducted on patients who have TRD, treatment-resistant depression. So all these patients have severe to moderate depression, and they've tried 2 or more antidepressants in the past with very little to no results. And these are now the participants in the study who are given multiple doses of psilocybin, and these scientists are going to measure the impacts on their personalities over several months. And the results are actually very surprising and even surprised the scientists conducting the study. So the study that we're taking a look at today is titled Effects of Psilocybin Therapy on Personality Structure. And it starts off by saying that 20 patients with moderate or severe treatment-resistant depression received oral psilocybin 10 and 25 milligrams 1 week apart in a supportive setting. Their personality was assessed at baseline and at a 3-month follow-up using the revived Neo-Personality Inventory and the subjective psilocybin experience with altered states of consciousness scale. So essentially all these patients have not had any success treating their depression with traditional antidepressants. They're going to be given 2 doses of psilocybin 1 week apart, and then their personality is going to be measured before their psilocybin experiences and 3 months afterwards. Now this report goes on to talk about why this study is so important. And it says that major depression is commonly occurring disorder associated with high morbidity, socioeconomic burden, and rates of completed suicide. It affects 10 to 15% of the general population and has been ranked by the World Health Organization as 4th leading contribution to global burden of disease. And treatment-resistant depression, typically defined as poor responsiveness to 2 adequate trials of different classes of antidepressants. TRD is associated with longer durations and high severity of disease. So they're essentially saying that depression is a major issue on a global scale, and they're hoping that psilocybin can be another and more impactful antidepressant to use to treat this disorder. And in the next section, they reference other studies which have seen positive impact treating other mental disorders using psilocybin. Recent pilot studies point to the potential of psychedelic-assisted therapy to treat conditions including tobacco and alcohol addiction, obsessive-compulsive disorder, end-of-life anxiety depression, major depression, and TRD. Typically, psychedelic-assisted therapy involves only 1 or 2 sessions in which a moderate to high dose of psychedelic compound is given in a supportive environment, with the intention of evoking peak or mystical type experiences characterized by a disintegration of ego boundaries and an accompanying sense of connectedness, oneness, and unity. In the next section, they talk a little bit more about how the study was actually conducted, and it reads that 20 patients suffering treatment-resistant depression, no improvement despite 2 courses of pharmacological distinct antidepressant medications for an adequate duration of 6 weeks minimum. The paper goes on to say that each participant received 2 dosing sessions separated by 1 week. In the first session, patients received 10 milligrams of psilocybin, and in the second, 25 milligrams. After capsule ingestions, patients laid with their eyes closed while listening to a music playlist. 2 therapists adopted a non-directive, supportive approach, allowing the patient to experience a mostly uninterrupted introspection. So I think this is pretty important here, how they're actually doing these sessions. So it's not people taking some mushrooms and then going off to a rave or a party and getting high and drinking. They're taking these mushrooms, they're lying down on a couch, closing their eyes, and listening to some relaxing music. And it sounds like the therapists are there in a passive approach. They're really only there in case the patient gets nervous or scared. Other than that, they're really not interacting with the patients at all. And what's interesting is that this is totally in line with how somebody like Terence McKenna advocates for taking mushrooms. He advocates that you take them completely alone, in total darkness, and in total silence.
It's easy to tell you how to do it, and it's amazing how few people do it right. You do it in darkness, on an empty stomach, in silence, and alone.
And more or less that's what they're doing here with these therapeutic sessions, except they're also integrating some relaxing music with it as well. So the next section of the study talks about the actual results that they witnessed from these 2 simple sessions of taking mushrooms, lying on your couch and your eyes closed and listening to relaxing music. And to evaluate this and kind of quantify it, they're using the Neo-PR domain scores, which is essentially a personality score, and it measures your personality on any number of different traits and kind of quantifies it with a number. And they measured everybody's personality before they had these 2 mild psychedelic sessions. Keep in mind that all these people were experiencing extreme or severe depression at that time. And then 3 months after those 2 mild sessions, they measured their personalities again. And the report reads that personality changes from baseline to 3-month follow-up. The Neo-PR domain scores significantly changed from baseline to 3 months post-psilocybin treatment. Neuroticism scores decreased, extroversion and openness scores increased. And in this chart, they break down each specific characteristic of a person's personality which they measured. And I highlighted in yellow all the personality traits which increased after the 3 months post-psychedelic session. And I want to read to you all the traits which did increase and were still increased 3 months after these 2 simple sessions. Extroversion increase, openness to experience increase, conscientiousness increase, warmth, gregariousness, assertiveness, activity, excitement seeking, positive emotions, openness to aesthetics, openness to feelings, openness to actions, openness to ideas, openness to values, trust, tender-mindedness, competence, dutifulness, achievement striving, and self-discipline. All of these personality traits were increased still 3 months later after these 2 simple sessions of taking psychedelics, lying down on a couch, and listening to music. Now, they also saw a decrease in their measurement of a lot of personality traits as well, and I just want to read through you a few of those that really stood out to me. So they saw a decrease in anxiety, a decrease in depression, decrease in vulnerability, a decrease in compliance, which is really interesting, a decrease in modesty. So for me, those are all great things that you do want to see decrease in somebody's personality. So regarding the results, the report goes on to say, thus from baseline to 3-month follow-up, the Neo-PR Big 5 scores for neuroticism significantly decreased, extroversion and openness scores significantly increased, conscientiousness showed a trend level increase, and no changes were seen in agreeableness. And the researcher states, to our knowledge, this is the first time personality measures have been reported to change among patients undergoing psychedelic therapy for depression. These results expand on the findings of psilocybin-induced changes of personality traits in healthy volunteers. So what they're saying here is that they've done studies like this on healthy volunteers just to see the impact of these drugs. But this is the first time that they've done a study to see the impact as an antidepressant and how this can change those who are severely depressed. And these psilocybin sessions appear to be a positive alternative for an antidepressant. And this paper goes on to say, in a subgroup of participants who had mystical experiences during their psilocybin session, openness remained significantly higher than baseline more than 1 year after the session. So let that sink in what they're saying here. So they're saying that 1 year after this session of them taking psilocybin and lying on a couch with their eyes closed, listening to music, 1 year later, they're still seeing these positive impacts on their personalities from that simple session. And the report goes on to say, however, a 3-month enduring change might suggest that it might not just be a state artifact, a notion also supported by the long-lasting psilocybin-induced increase in openness observed in healthy individuals. So they're suggesting that this may not be a state artifact. In other words, they're saying that the persons are not just still high on psilocybin, they don't still have the psilocybin in their bloodstreams. This is making a physical change in their brains, a long-lasting impact from this simple session. And they're saying that this is not an anomaly. This is in line with what this other study also found when healthy adults did a psilocybin session as well. They go on to say that the observation that a single profound psychedelic experience can lead to lasting change in personality is intriguing, especially when considering the relative stability of personality once adulthood is reached. Studies have shown that personality changes after age 30 are typically subtle and or gradual, that is around 1 to 2 T-score points per decade. Thus, our observation of relatively marked changes in personality within a short time span challenges this assumption that personalities can only change slowly, gradually, and subtly. A systematic review of more than 200 studies concluded that enduring and large changes in personalities are obtainable through a range of therapeutic interventions. but to our knowledge, none so rapidly as marked as with psychedelics. The phenomena of psychedelic quantum change may be relevant in this regard, where one's outlook and behavior rapidly and profoundly changes, such as with sudden religious conversion experiences. So they're saying, to their knowledge, they don't know of any other way to permanently change somebody's personality so quickly as with a psychedelic experience. What can usually take a decade to change can literally change with one psychedelic session. And I find it very interesting that they're comparing these psychedelic sessions with that of a deeply moving religious experience. They're saying that these psychedelic sessions of these participants lying on a couch, listening to music on psilocybin is just as impactful and moving to those participants as a deeply religious experience would be. You know, Terence McKenna has this great metaphor that culture is your operating system. And he says that sometimes you need to reboot your operating system or completely wipe it clean and start from scratch. And he says that there is no better way to completely clean out your operating system than with a high-dose psychedelic experience. And that metaphor that he made back in the 1990s or 1980s is completely in line with what this research report is saying. That to their knowledge, there is no better way to completely change your personality and on a permanent timeline than with a psychedelic experience.
And then the question is, well, how does one download a new operating system? Well, first of all, you have to clear some space on your disk. The best way to do this is probably with a pharmacological agent. Psilocybin is an excellent disk cleaner. You can put a lot of things in the trash and have them just disappear with a psilocybin upgrade.
So if you are interested in reading this report for yourself, I'll have a link to it down in the description below. And if I do make any other videos like this breaking down research around psychedelics, I'll have those in a playlist which you can click right here. If you enjoyed this video, help me out by hitting that like button and subscribing for more psychedelic videos just like this one. Thanks so much, and I'll see you over in the next video.